Well, Matthew Holt, the summer deal lull continues, and now I've started day trading Robinhood stock. Yeah,
You up?
that's what's happening right now. Robinhood, me, day trading. Like, what
Up,
do I gotta do?
down, flat?
Bought on the low, sold on the high. It's the August 5th episode of Health in 2.0. So you leave me and go on vacation, and Amwell buys two companies. You come back, it's like, all right, what else is going on?
We've scratched up something. So, I can't make Amwell buy companies every week. Well, a little bit of controversy about how much they paid and who paid what, and, whether Brian Dillon was right or wrong. There's some stuff that's going to come out there. But nonetheless, you drive me back from vacation. Now I'm back in my boring office, and we do about boring deals. So
they're not that boring.
This time last week I was water skiing, and now I'm talking to you.
They're not as, Amwell didn't buy two more companies. It's not that. So here we go. DomaniRx. This is kind of cool. Anthem, Humana, and a software company are teaming up to launch a PBM. Tell me more.
So I don't think it's quite a PBM, right? But the company is SS&C, which has got 80%. Amwell and Humana put in 138 million for 20%, valuing the whole thing at, by my math, a little bit around 800 million. And don't forget, it's about, that's the company which runs hedge fund back office stuff. So it deals with a lot of numbers. What are you? I don't know, but clearly what we know has a lot of numbers of complexity, PBM accounting. And who does not own a really big PBM? Anthem, Humana. Who does? Optum, Cigna, CVS, right. So must be something going on there.
All right. What about Connections Health Solutions? They get $30 million. What's this for?
Yeah, Heritage Group, which is put the money in. It's one of those private equity groups. This is something to do with Connections already doing sort of opiate, substance abuse and all stuff like that. This is to go to help sort of expand them, I think, online to do 24/7 crisis help for mental health solutions.
All right. Oaks letter round, 45 million goes into Veda Data Solutions. That brings their total up to 52.2. This is like AI provider data. Tell me more, Matthew.
Yeah, you interviewed the CEO, who's on
Megan Gaffney, like a couple of years ago at HIMSS.
Yeah, she was talking that she said with the most unsexy data thing I've ever seen. This is to do with provider data. Can you get the right provider data into your directory? And obviously, can you deal with not getting surprise medical bills, which is now against the law? So I think that's why they made a big leap.
All right, Connie Health, they get 13 million, brings their total up to 16. This is a Medicare navigation platform.
Yeah, well, don't forget, Medicare navigation, Medicare Advantage is the most profitable part of the health plan business. Everybody you can get on board is worth hundreds of them or thousands of dollars a year. So if you can find the right people, there we go. If you can find the right people, you can guide them around, you can do very well. I'm not quite sure what these guys bring to the table and whether they're going to fire the platform at other brokers or fire it directly at consumers. But, there's going to be a lot of people playing this game. I ran a company called Easy Health. Easy Health? Was it called Easy Health the other day, which was doing, I don't have to get their name right. Is it Easy Health?
Dr. Easy.
Yes,
Dr.
it was Easy Health, which is now becoming, which is venture backed, which is one of the biggest brokers now in getting Medicare Advantage onto, getting people onto Medicare Advantage and selling them onto health plans. So this continues to be a big deal until, of course, this week, you noticed that Kaiser Permanente, or this you may have heard of, got in a bit of trouble, as has United and Anthem and other people in the past, for charging the government more than they should be charging for those Medicare Advantage members. At some point, somebody will do something about this, but at that point, we're not at yet. And so right now, the scramble for Medicare Advantage is on. And so Khosla have kicked in, as has
Tango Health Tech.
Tango kicked
the
in
other investor.
To these guys, Connie. So good luck to Connie. It's just a weird name to call it, Connie.
Wait, just because you couldn't spell it. Connie. No.
I'm always reminded of Connie Chen, who now is the Chief Medical Officer of Lyra, who will be at
Policies, techies, and VCs. What's next for healthcare?
I got
just
it.
The hottest health tech conference to be happening this year.
In
virtually.
the first week of September, online, virtual.
Online, virtual, with a star-studded lineup of basically everybody who's raised a ton of money in health tech. You should go check this out if you haven't.
Can we quick shout out? I would like to shout out our platinum sponsors, Avenir Health, another data company from the health plan world. LARP, Transcarent, our new agency sponsor, 120 already, rolling in there. And then our session sponsors include ADN, Crossover Health, Merck.
The name butchering comes free, Crossover Health. Thank you for your support. And go on.
Merck, Global Health Investment Fund, Newtopia, and Zeus, which butchered its own name without my help.
Maybe next time you should let me read the sponsor names. You gotta pay extra for that.
You won't let me talk to the sponsors, negotiate with them, listen to them, go anywhere, can't even read their names. What am I allowed to do? Nothing. I might as well not be here.
You can sponsor for $7,500 and be acknowledged by Matthew, where people can understand, but that costs $8.
Get us out of here.
Oh my God. Okay. So yeah, go to the website. It's whatsnexthealthcare.com. Check out those sponsors if you didn't quite catch who they were exactly. And also our great agenda and star-studded speaker lineup, because it is definitely star-studded. So yeah, you got to register for this one, people. But please do and check it out. Also, you can follow us over on Twitter. He is at BoltyBoy. I am at Just Amasa. And we're going to do the most fantastic and also obnoxious thing in the world, which is promote every single one of the 28 sessions that we've got in this thing. Sorry. So that you can see exactly what you would be missing if you chose not to register. All right. And then be sure to also sign up for the email newsletter over there at thehealthcareblog.com.
Which I wrote even though I was on vacation. Which I wrote last week, even though I was on vacation. Although there will be no THCB gang today, because I haven't got my shit together, having come back from vacation with Awesome last year. There will be next week, which is...
Listen, nobody cares about your pithy excuses over there.
Let's go. Goodbye. Clearly,
one of us is running the show and the other one is just riding along on her coattails. And with that, we leave you. We'll see you next time, everybody. Bye.